Hello, I'm delighted to be talking to you today in this first staff video during my time as your Interim Chief Executive Officer. I've been in the health service now for the last 25 years, most recently as your Chief Financial Officer, and prior to that as National Director for Mental Health, and also as Regional Director of Operations for Dublin North East, covering all community and hospital services. The two key priorities I see over the coming months are access, protecting and improving access to services, and engaging with people, both the staff and the people using those services, particularly those who are having difficulty accessing those services. For me, access is about accessing our scheduled care services. That means trying to reduce and continue the progress we're making on reducing our waiting lists, both across community and hospital services, and also improving access to our unscheduled care services, our emergency care services. We know we can't improve the congestion in our emergency departments unless we all work together to improve the flow before people go into the emergency departments, during their stay in hospital, and make it easier for people to leave hospital when their care is finished. In terms of how we want to help our services, what we need to focus on in the centre and are focused on is how do we help our community healthcare organisations and our hospital groups in order that they can help the frontline services that they're responsible for do the best they can for their patients with the resources they have today. We will always strive to get additional resources to recruit more staff, and we know that capacity is needed. But for the next number of months, we need to make sure everyone is assisted to make the best use of the resources that they have today, to work in an integrated way, both across hospital and community and within community services, in order to improve as much as we can the experience of service users and families who are trying to access our services. In terms of the oncoming winter, I think the reality is that it's a period of uncertainty. We do not know how bad things may get or the extent to which our services, which are already under pressure, may be under further pressure. We are planning to do everything that's practical in order to mitigate the impact on our services, to continue to improve waiting lists where we can, and to assist colleagues, including in our emergency department, who are under significant pressure already, by trying to improve the flow before patients get to emergency departments, through the hospitals, and improve the flow out of hospitals back into home and into community. Because we know that's the only way we can mitigate pressure on the emergency department. It's not a problem we can solve in the emergency department. What I'd really like to say to staff, first, if we look back over the last 2.5 years, staff across the entire health and social care service have had a very difficult time during both the COVID pandemic and during the criminal cyber attack. I believe they've responded brilliantly. I want to acknowledge that, and I want to thank all those staff for that. In acknowledging the efforts over the last 2.5 years of the health sector and looking forward to what we need to do together in the coming months, it's important that we acknowledge that includes our primary care colleagues, including general practitioners, and importantly, our Section 39 and Section 38 voluntary organisation partners. I also want to thank them for what I know will be the significant efforts they will put in over the coming months to maintain, protect, and where possible, improve services for the patients, for the service users, and for the families that rely on them.